Ajab Khatun, wife of Qaimdeen, 32 years old, belonged to a village called Malhar Kolu of Tehsil Kankot, district Kashmir. She had fractured her leg previous week before the floods came and so was unable to move. On the night of August 6, they were sleeping in their home along with their 2 children. Just as the clock struck midnight, they heard panicked voices. They went outside and saw chaos all over. The water had hit their village with surprising speed. The quantity of the flood water was huge, more than their expectations. Qaim, Ajab, and their neighbors started moving to higher ground for their safety. Hands started its rescue operations as soon as the news reached at Hands Disaster Cell in Sakkar. They dispatched their team through boats. Ajab and her husband were rescued by one such team. The boat took them towards a river embankment, the only safe place left. After that, many such rescues were made by the Hands team, and they remained busy throughout the night in evacuation activities. Fortunately, their children were also rescued safely. Next morning, Hands personnel started the registration process of all the displaced persons. Each family was issued a Hands family support card to record the aid that they received. Later, Hands team members asked the affected people to nominate a few of their own for a management committee that would look after the camp. Later in the day, Hands boats initiated the process of bringing tents and food. The distribution was well managed. Soon a hand pump was also installed and a number of pit latrines established. Qaim and Ajab were satisfied and relieved to see the medical team taking care of pregnant women and children, and a vet doctor vaccinating their livestock. Health and Nutrition Development Society is registered under Society Act of Government of Pakistan, not-for-profit organization working in social sector since 1979. Hands is providing benefit directly to more than 13 million population of more than 17,000 villages in 20 districts of Pakistan. Pakistan, a country that is renowned for its fertile lands, rich crops, and agricultural diversity, has now been ravaged by one of the worst floods in the history of mankind. Apart from the death toll of nearly 1,800 men, women, and children, over 20% of the country is submerged underwater. Over 1.5 million acres of agricultural lands and crops have been destroyed. Over 20 million people have been rendered homeless. Of these, over 7 million IDPs have been afflicted in 12 districts of Sindh province alone. Hands immediately declared emergency in the organization. The operation was led by the general manager, who divided the operational area into 3 hubs. The Northern Sindh hub, based in Sakkar, Southern hub in Thatta, and the Quetta hub. Each was looked after by a hub manager. Hands immediately mobilized its 1,264 staff and 10,000 volunteers, along with 40 vehicles, besides deploying 2 boats in each district, that is Thatta, Kashmir, and Jacobabad. A total of 83,163 people were evacuated from the most vulnerable points by the Hands team. Hands has established more than 300 relief camps. Each camp comprises of 30 tents, or a covered area of 30 families. We are providing support to more than 9,000 families and 63,000 individuals. Each family was provided initially with 2 cooked meals a day, in addition to milk for children, and later they were provided with a bag of 1 week ration comprising of rice, wheat flour, lentil, tea, milk, potatoes, onions, oil, sugar, and beans. Hands has supplied in just 1 month more than 550,000 meals to these families. We also supplied nearly 9,000 hygiene kits comprising of soaps, detergents, broom, comb, nail clipper, clothing, toothpaste, bucket, and a mug. The non-food items were also supplied to 9,000 families, comprised of plastic mats for spreading in tents, kitchen utensils, water cooler, and jerry cans, etc. Hands largely succeeded in ensuring enough water supply and toilet facilities under the most challenging circumstances. Water connections, water tankers, hand pumps, and tap water were the tools used to maintain sustained supply of more than 1 million gallons every day for the displaced people. We are providing safe water through different methods like chlorination, aqua tablets, pure sachets, and live straw filters. 3,000 of these live straw filters were supplied. Hands health teams quickly rushed in with mobile camps. Fixed medical camps were stationed at all relief camps in the flood-affected areas. The medical teams have distributed more than 400,000 ORS packets to protect children and the elderly from dehydration and gastroenteritis. Hands has planned to conduct more than 2,500 medical camps that would see 300,000 patients and conduct more than 5,000 health and hygiene awareness sessions. Around 10,000 women will be screened for antenatal and postnatal care. The medical team will ensure more than 10,000 safe deliveries and will provide them with reproductive health kits comprising of required contraceptives after counseling session. 9 health facilities, both from public and private sectors, are already selected as referral facilities and for indoor management. Hundreds of women and neonates will be provided indoor hospital services free of cost. These services include OPD, lab, ultrasound, and ambulances on a round-the-clock basis. Schooling and education for children in relief camps is yet another vigorous initiative undertaken by Hands. Students are being taught both in the school setup in the camps and in the school buildings that have been converted into relief camps. So far, 50 schools have been established in makeshift camps. By the grace of Allah and from the help of His partners, Hands has raised 337 million Pak rupees. That is $4 million for the relief activities. It will take 3 years to rebuild the streets, homes, water wells, hand pumps, water reservoirs, toilets, and schools, health facilities, and farms that were ravaged by the colossal floods. Hands did an initial assessment of destruction and are planning to revitalize 33,600 families in 12 union councils of 6 affected districts. This means 235,200 populations. Hands' initial estimate shows rehabilitation of a person would require Pak rupees 21,248 per person, and a family of 7 members would need Pak rupees 150,000. A 50 households village would require Pak rupees 7.5 million. A whole union council of 57 villages and of 20,000 population would require 428 million only. This means the ultimate requirement for the next 3 years is 5 billion for 6 districts. Hands require your generous support to continue these efforts to make our dreams come true. Healthy, educated, and prosperous Pakistan. Millions of Pakistani women, children, and sufferers are looking forward to you. Let's work together to give them a ray of hope.